Hello, I'm Dr. Beech, and in this video we're going to talk more about those two common causes, the most common causes of neck and back pain. We talked about forward head tilt in a previous video, and today we're going to be talking about swayback. Swayback is where the lumbar curve is too much curve in the back. Now first, let's just take a look at how the lumbar spine is moving when we go into flexion and extension. Flexion and extension means bending forward and bending back, and what happens to the joints in the spine when we do that. So let's take a look at that. So noticing those facet joints and how the facet joints are opening and closing as we're moving back and forth. They become the most common source of pain and chronic pain in patients. So when we get swayback, it means that the postural way that we're holding our back is we're curving the lumbar spine too much. Now there is a normal lumbar curve. It's about 30-35 degrees. That's a normal curve that's we should be maintaining in the lumbar spine. Swayback is when we have too much curve in the low back. Now let's take a look at how that can occur and also how it affects the neck as we go into swayback, how it creates forward head tilt. So as you can see there's a connection between what's happening in the low back and what's happening in the neck. So we see this very, very common. A person is leaning back, arching their back too much, and then having the forward head tilt to go along with it. Now in the other video we talked about the ramifications of forward head tilt. We're not going to go into that here. But in the low back, because those facet joints that we talked about start to jam together. That jamming together of the facet joints we call facet syndrome. And as it pushes the facet joints together, the ligaments surrounding that area can become inflamed, and then as a result of that, the muscles become too tight in the low back, and that creates chronic low back pain. So then, what do? Maybe we do some stretching. We might go for physical therapy and if we need treatment, or come to the chiropractor. In chiropractic, what we do is we use physical therapy to relieve the muscle tightness and that type of thing. We also do manipulation of the joints and relieve the tension in the facet joints. But in my experience, that alone isn't enough. Just doing an adjustment, even doing exercises, typically isn't enough unless we develop a plan, a treatment plan, to actually change that swayback. We have to change that chronic swayback, which is putting the chronic tension on those facet joints. And so that's what we do in our office. We design a treatment plan for correcting both the swayback and the forward head tilt. And both of those are in connection to what's happening with the feet. And we'll talk about that in another video. But the main concern here is that we have to look at the body as a whole. We have to look at what is the etiological factor that's creating the aberration in the spinal curves that is then in turn putting stress on the spinal joints and the spinal musculature that's creating the pain. So I hope this was an instructive video, and then we'll talk more about how this all goes together with the feet in the next video.